Good evening. From 5 p.m. yesterday to 5 p.m. today evening, Gujarat has had 376 cases of COVID-2019 which have tested positive. Today, as many as 153 people have got discharged after successfully undergoing their treatment for COVID-2019. During the course of their treatment, there are 16 people who have unfortunately died today with COVID-2019 as the primary cause of death. There have been 13 others also who have unfortunately died today, but who were already suffering with serious and severe comorbid conditions and also contracted COVID-2019. The district-wise breakup is there on our portal. The recovery rate and discharge has been a concern, and with a view to really improving this in our high-powered committee or the core group chaired by our Honorable Chief Minister Shri Vijay Rupani, in the presence of our Honorable Deputy Chief Minister, Shri Nitinbhai Patel, it was decided today, in a few days back, that we would have senior specialists and intensivists, critical care specialists. It has been decided that they would also be invited to see and advise us, our teams, on improving the quality of care and ensuring that we are trying to, we bring down the mortality rates, we bring up the faster discharge rates and so on. So there was a meeting held today morning at the Medicity campus with a team of private doctors, people like Dr. Tushar Patel, Dr. Jigar Mehta, and representing a team of about 25 such specialists from across the state who are really good, top class, along with our own top class specialists from the Medicity like Dr. Kamlesh Upadhyay and other specialists like Dr. Rajneesh Patel, Dr. Rakesh Joshi, and the Medical Superintendent Dr. Modi, as well as our own Additional Director Dr. Raghav Dikshit, our Chief CPO Dr. Navnath Gawane, and the Commissioner Health Shri Shivhare. We all had a meeting this morning, and it has been decided that they would start, and in fact they have already visited the wards today, and they will be starting this intervention at the earliest. The Ethics Committee at BJ Medical College is also giving an approval for a very special trial which is being done under the aegis of Dr. Tejas Patel, Dr. R.K. Patel, Dr. Parthiv Mehta, Dr. Bipin Amin, Dr. Atul Patel, under the overall leadership of our Additional Director, Medical Education and Research, Dr. Raghav Dikshit. This is for studying the new possibilities of the disseminated intravascular coagulation or thrombosis, which is now believed to be one of the main cases, reasons for COVID-2019, as has emerged from some international reliable publications based on autopsies done in Italy. Similarly, we have another piece of good news today, that in the WHO Solidarity Trial, which is an international clinical trial which is going to be carried out in more than 100 countries, with the Indian Council of Medical Research leading the trial, there are 4 treatment options against standard of care. So these, it will have 5 arms of study, namely the use of the drug regime of remdesivir, lopinavir, interferon, chloroquine or hydroxychloroquine with standard care. And the parameters to be studied will include mortality, duration of stay, ventilation, or serious adverse drug reactions. So all these issues will be studied. So in Gujarat, 5 institutions have been identified for this. This has been launched, as you know, by WHO and partners, and it is in India, Indian Council of Medical Research, ICMR, is leading the trial. So BJ Medical College and Civil Hospital Ahmedabad has been already registered and started the process of these clinical trials. Similarly, the SVP Hospital Ahmedabad, the Government GMERS Medical College Gotri Vadodara, Government Medical College and New Civil Hospital Surat, as well as the PDU Medical College and Hospital Rajkot are also joining this effort. They have also been identified for this effort. So on this note, we also want to add 2 heartwarming stories today. Usually we realize that people who have comorbidities are more likely to succumb to this illness. But today we have some excellent news from Navsari district. Our very active collector and DDO there, Srimati Ardra Agarwal, and the district development officer, Srimati Prashasti Parikh, and the entire team there has shared a very nice story. There has been a Yashveen COVID hospital. A patient who was 65 years of age had a chronic heart condition. He was a chronic heart patient with a history of angioplasty in 2015. He was treated, given this condition, without the use of hydroxychloroquine as per the advice of the cardiologist. He successfully recovered and has been discharged today. Similarly, we also have a case of a patient who has been suffering with HIV/AIDS for about 2.5 years. So which means that there has been a compromised immunity in spite of it, in spite of the fact that the patient was severely anemic at the time of admission. This patient too had got admitted on 15th April, but is successfully discharged and has come out of this. This is again a great story, heartwarming story for all of us, and it's a great endorsement of the efforts made by all our COVID warriors who are working in the hospital floors, the wards, and this includes from the top intensivists and specialists to the residents, to all the medical officers, the nurses, sisters, and the all the staff, paramedical staff, etc., the entire team which is doing some wonderful work. Thank you.